I think first and foremost, we now have, with this IHME Brain Health Atlas that I mentioned before, a great tool for looking at the prevalence, incidence, and economic burden of brain health conditions country by country around the world. So I think that's what I would call as a policy tool. And then as far as other policy ideas, I do like the European Academy of Neurology's brain health strategy, which is now turning into a brain health mission. This is essentially looking with this brain health strategy at across the entire continent of Europe. What things can you do for individuals, for clinicians, for public health thinkers, for policymakers to try to reduce the burden of these conditions and to increase brain health? And the EAN is really kind of, this is a strategy, right? That then they need to work in through policy channels to get policymakers to stand up and pay attention and actually invest. And then finally, I would say that there are some country-level brain health plans that have been rolling for a while. Norway is perhaps the best known. They've now just announced that they'll be extending their initial brain health plan for their country into a sort of second funding period. And that involves in Norway, as I understand, dedicated research institutions that can research brain health. It involves advocacy, and it involves training of clinicians and stakeholders across the spectrum. So I think, to me, Europe is probably leading in the field of brain health and driving this kind of novel activity forward. And maybe that's because Europe has a bit more of a sort of a government-led approach to healthcare, and so if the government thinks it makes sense, then it can really push out large scale change. But I also think that Europe is special because you have so many aligned institutions like EAN, which collaborates with the European Brain Council, and the advocacy body EFNER, and psychiatry, European Psychiatry Association, et cetera, et cetera. So there's just I think in Europe you have a really aligned group of major stakeholders that want to see this happen in brain health.